Often heartbreaking situation parents of children with life-limiting illnesses can find themselves in. This has been in the spotlight recently with the cases of Charlie Gard, whose parents battled with doctors in court to keep alive, and Tafida Rakib, whose life support machine was kept on after her mum and dad won a similar case in the High Court. So-called Charlie's Law would help avoid other families being taken to court. Baroness Finlay is bringing forward her proposed new law in the House of Lords tomorrow. And also with us, Charlie's parents, Chris and Connie. Welcome all of you. Thank you for coming in. I know it's been a long, hard battle for you both. Connie, how are you feeling about the prospect of this becoming law now?
Yeah, it's good. You know, we've been working on this for over 2 years now, and we've got the backing of, you know, many senior people. We spoke to, you know, professors of ethics and got their backing, and senior politicians and doctors themselves, other parents, and you know, we're trying to find a way that we can all come together and try and prevent cases going to court in future. So it's been a long road, but I feel like we're hopefully getting somewhere now, you know, and preventing people going through what we went through.
I mean, you were plunged into something unimaginable. You had a son who was in a very serious health condition, and you found yourselves then having to fight the doctors over that period. Chris, I mean, what was that like? He died before he was one, and for much of his life you were in a fight with those who were caring for him.
Yeah, I mean, I'm sure many people would agree with me. There's not many worse things in life than losing your child. But when you've got a child with a life-limited disease and you're being taken to court at the same time, it doesn't get any more distressing than that. So, you know, we know as we've been through it that we've got to try and find a way of making it better for everybody, not just for parents, you know, because it seems like it's just we were two parents who lost a court case who now think the law needs to change. You know, I think everyone has seen that something needs to change, including, you know, former heads of the BMA and so on. So it's just about finding a way better for parents and for doctors, you know, because I'm sure doctors would prefer to be, you know, on the wards doing their job rather than preparing witness statements and attending court, you know. So it's about finding something that's better for everybody and that does not go against the best interest of the child still.
What could have made it better for you two?
Well, mediation, I mean, mediation is a major part of this bill because, you know, we asked for mediation and it was refused. Now, the very least mediation would have done for us would be, because as Charlie's parents, it very much felt like at the time that whatever we said, it did not matter. You know, me and Connie have not got medical degrees, so it was kind of, you don't know what you're talking about. Whereas with mediation, the very least it would have done is made us feel like we had a voice, what we said mattered, and yeah, it's just something that we feel that needs to be done, so that parents feel like they're being listened to.
So Baroness Finlay, you've got this bill going through,
Yes.
the so-called Charlie's Law. Why did you feel it's so important to do that?
Well, the part of my bill is part of a whole package of access to palliative care for people wherever they are. That's all ages. And then when you have this very, very distressing situation of a child who can't speak for themselves and the parents are trying to represent what they view as the child's wishes and feelings and their values, and they feel that they're not being listened to, then that compounds their anguish and it makes it more difficult for people to make good decisions.
Are you surprised they were refused mediation? I mean, you got mediation, didn't you? But in the end, it was right at the end.
We got it in July, but we actually asked for it before the court started, and it was refused.
I mean, I think if people are beginning to diverge, then there's a communication problem emerging. And at that point, you need to say, how do we improve communication? How do we improve understanding on both sides? How do we develop trust again? And that's when mediation should come on really early, not late. Because once people have diverged, they've taken fixed points and views, and that conflict doesn't help anybody. It doesn't help the clinicians either.
So what exactly would your bill do? How would it change things?
It would require that wherever the child is being looked after, the provider of healthcare must offer mediation early when there is a dispute emerging. And then when that happens, for mediation to work well, of course, you need the information, and parents would need information shared with them without having to fight for it, to know what the results are from investigations and so on, but also then that their views are taken into account, not just the medical clinical views, but their perspective of the child, what the child is responding to, what they view as the child's feelings and wishes. So it wouldn't change the concept of a best interest, but it would say that what is really in the child's best interest as a whole human being goes wider than the clinical concept.
Connie, how important was it to you to feel you had done absolutely everything that you could do to fight for Charlie?
That's literally all you can wish for as a parent. You know, with a sick child, you need to know that you've done everything that you can. We still live with that what if. I know at the time we did everything we could, but you know, I very strongly feel that if we could go back, and if I knew then what I know now, that things would be different. So I still feel guilty. I still feel bad, and that I could have done more. You know, at the end of the day,
you went to court.
I know, but we were taken to court. We didn't want to go to court. You know, all we wanted to do was give our son a trial of a medication that wasn't going to harm him for 3 months, and it would have only cost £1,000 per month. And in the end, we had to raise £1.35 million to get him over to America, and then in the end, we weren't allowed to take him. So you know, everything was set up. It was a reputable hospital, one of the best hospitals in the world. We were trying to take him to in New York. We had the plane set up. He was fit to fly. You know, there was nothing preventing us. But then suddenly we weren't allowed to take him. You know, and we think parents, as long as they're not harming their children, should be able to give them that opportunity to get better. You know, we were told there'd be an up to 58% chance of working. I don't know who wouldn't want to try that, you know.
How important is it to you both emotionally to see this law coming?
Oh, it's massive. It's massive for Charlie's legacy, you know, because one thing we are very passionate about is making sure that Charlie's legacy now is a positive one. You know, we received a lot of negativity because we were up against a children's hospital, but we want Charlie's legacy to be a positive one, and if we can prevent one family from going through what we went through in court, then, you know, job done. And it's just so important to us because, you know, we've had a child with a life-limiting illness and we've lost him, but just going through the hell of courts, and we need to try and to do anything we can to avoid that. It's not good for anyone. It's not good for the patient, the family, or the doctors, or the judges. You know, they've got to make difficult decisions. So if we can find any way of stop getting to court, then it needs to be done, and we think Charlie's law does that.
Thank you. Thank you very much.
Thank you.
People at home getting in touch. Leanne on Facebook says, until someone has been through this themselves, then sadly they will never really understand the pain that this family's gone through. Luna on Facebook, isn't there already mediation services in place to give parents a voice? The law sure needs to protect medical professionals' decisions. And Pamela on Facebook says, sorry, but we should be allowed to question the establishment when they're making decisions about our children. They don't always get it right. England's school